what was the old way of doing things, and what did you find in terms of your key findings?
So we did a lot of literature search, and being an experienced radiologist over 20 plus years, the older way of consultation used to be more like a curbside consultation. Physicians used to come with, like a printed film or a CD, and they used to ask opinion on a particular thing. The disadvantage of those is, first of all, you need more time. The physicians have to come to the department and, find the right subspecialized radiologist for an opinion. And when they ask for a consult, it's more like a question-related, consult rather than the entire study. So what they get is only specific to one question, not like a detailed report. So the problem with current that kind of consultation is they cannot use the same verbiage what we use in radiology compare to the other physicians. So I may say like certain types of cancer or certain types of recommendation, they may interpret as differently, and then it can go into, because it's a verbal consultation. That's one of the disadvantage of older consultation technique, and also as the films, they undergo degradation. So if you if you don't save it properly over time, they are subjected to all this loss of data, including the CDs. If there is a scratch, you may not be able to open the CD at all. So those were the limitation of older way of doing consultation, especially when the patients are referred from a different hospital or a institution.
What's a better way, more efficient way of doing things that you've experienced?
So people figured out a way of copying DICOM images to a CD or a DVD or some kind of a storage device. The problem again, it's sort of that's the current standards. Most of nearly I would say 80% of the hospitals they use, but still that has a lot of limitation, such as many of these DICOM viewers which they put on a CD, they never open up, and it takes so long to upload those DICOM images on a viewer which is provided on the CD or a DVD, and many times they're subjected to data loss. So radiologists don't have time in sitting and waiting for those images to be uploaded. So this is the era where we need instant images accessible, and that on our PACS. Then we could provide a detailed and full report similar to any studies done in the same institution.
Tell me about the improvements that you've experienced even within your organization with the newer, more modern way of doing things, where the viewing of images is instantaneous and you can collaborate more effectively with fellow physicians.
So that's a great question. As you know, we are one of the early adopter of Live Image, which is like a cloud-based service. It's a fantastic way. All our clinicians love the service. The reason because the data is on the cloud and it can be pushed to the PACS, and there is no loss of the images or the data. And also it's easy to navigate on our own PACS rather than opening up on a third-party application. And many a times, it increases our efficiency in providing a detailed report, not just a concise point, question. So our volume has exponentially increased over the last 10 years in providing the secondary consultation. And it has become one of the common way of transfer of patient from like a smaller facility to our tertiary hospital. There is many a times, when the patient still on their route to the hospital, we already have a full read on a study done on an outside study, So
how has it improved patient care?
So it's a great question. So we are looking into, in terms of, the time efficiency, how much there is a decrease in time in providing a secondary read from the time the physician has ordered a study versus what it was earlier on a CED when we provided read. And also we are looking into the number of minimizing the repeat scan. So there is good thing is there's already a literature from I think Cleveland, Ohio. One of the hospitals has published a good number of data on cloud-based service and looking at how many times the repeat imaging is avoided. So in their experience, there's like a statistical significant almost from repeat imaging before like live image cloud-based service for secondary consultation was like 21% to 12%. It's almost like 50% reduction. This is just for a head CT. And there was like a substantial decrease on cervical spine CTs, substantial decrease on chest abdominal pelvic CT scan, in terms of avoiding a repeat imaging. So I think that itself speaks about, the quality and the efficiency, what we add value in terms of patient care.
What are you hoping your colleagues learn from this, take away from this, hoping to impact in terms of your fellow colleagues in the healthcare system?
So interestingly, live image has become the way to go for secondary consultation. There is no way we can go back to anything else. This has set a new standard for patient care, especially in the setting of secondary consultation. I think people who use it, they will never go back. This has become a mainstream now. Yeah.
Thank you very much. Appreciate your time.
Thanks a lot. Yeah.